Let's talk about BPD and paranoid ideation. BPD can definitely distort thinking and perception, and definitely when we are triggered or under stress or extreme stress, it tends to bring out the paranoid ideation. It's a symptom that many people with BPD experience. People with BPD, like myself, struggle to maintain a healthy and consistent self-image. There are frequent mood swings, and very often our inner world is filled with turmoil. And during times of stress, which may be caused by interpersonal conflict or lack of self-confidence when facing personal or professional challenges, people with BPD may feel that sudden change of danger, that other people are going to be a menace to them. They may be suspicious of others, or even the people, we'd normally trust suddenly become suspicious. I also just want to add that another issue here is that oftentimes people with BPD have been betrayed genuinely and have people that they've trusted for lengthy amounts of time betray them. So there are elements of truth to the paranoia, which can sometimes ground the paranoia or make it worse because there are elements of truth. And these feelings of suspiciousness or paranoia may last just for a few days, a few weeks, or indefinitely. Stress-related paranoid ideation is a term chosen by mental health professionals to describe this state of mind, which can cause a great amount of misery and mental distress. And the stress-related paranoid ideation is actually one of the 9 possible diagnostic criteria for BPD. And in one comprehensive study, has said here, patients receiving mental health services, 87% of participants with BPD reported experiencing the symptoms of paranoid ideation. This type of paranoid ideation is classified as non-delusional, which separates it from the paranoid delusions associated with psychotic conditions. Under the influence of non-delusional paranoia, people with BPD may see signs and symbols of hostile intent everywhere. They may detect hidden meanings in speech, body language, casual glances, and other behaviors that would seem non-threatening or perfectly benign to anyone else. And I can definitely relate to all of that. And unlike people with delusional disorders, men and women experiencing stress-related paranoid ideation are not convinced they have absolute proof that such conspiracies are real, but their fears are powerful, persistent, and difficult to overcome. Once the stress and anxiety that provoked such feelings is relieved, the person with BPD experiencing the paranoid ideation may regain their normal perceptions once again. We're going to talk quickly about this article as well. The difference between the non-delusional paranoia and the delusional paranoia is also schizophrenia. Here's another example of what that paranoia can look like. For example, an adolescent with BPD might see 2 of their friends talking in the hallway and develop the paranoid belief that his friends are secretly hating on him and planning to humiliate him. Another one is a BPD adult may misread their partner's cues that they want some alone time as a sign that the relationship is just over. Here are some things to cope with the paranoia in BPD. Biofeedback, deep breathing, meditation, therapy of course, medication, things like Tai Chi, yoga. And it's just important to keep in mind that while there are many stress relievers and ways that you can help yourself through the paranoid ideation, it is important to seek professional treatment, as paranoia and other BPD symptoms can affect many, many different areas of your life. Don't ever be afraid to reach out and ask for help, as it's the bravest thing you can do.